Vascular diseases are incredibly common in America, affecting both men and women. Today we have Dr. Sharma from Arizona Vein and Laser here with us to discuss symptoms and treatments. Doctor, thank you so much for being here with us today.
Thank you.
So starting out, first of all, give me a little bit of an overview of what vascular diseases are and kind of some of the symptoms we can look out for.
Most of the vascular diseases, if it comes to the younger as well as the older people, is the venous disease, the disease with the veins. And arterial disease is mostly in the older generation.
Okay.
And the most symptoms which we can have with the venous disease is a swelling of the legs feeling heavy or tired. That's very common because these symptoms are not very severe and they have been there for many years. When we ask the patient these questions, then they say, yeah, my legs have been feeling very heavy for the last few years.
Oh, wow.
And once we treat them, then they say, my God, I mean, my legs feel so lighter now.
It's almost like they don't even realize that they're having the symptom.
That's right. Most of the people, they think, getting old is the problem.
I'm just fatigued or I'm
That's
tired.
Right. That's right.
Right, interesting. So if you do find that you have kind of that heaviness in your legs, is there anything else that will kind of tip you off that would be like, okay, now I need to go speak to someone about this?
Absolutely. I mean, if you see some veins popping up on your legs, or your legs feel really heavy or tired or achy,
Okay.
or maybe the cramping in the legs at nighttime, that's also very common in these patients.
Gotcha. So I'm currently expecting, so I do get cramps in my legs at night, but that's obviously something to do with just the fact that when you're pregnant, you're much more vascular. And so that's also something that affects women while they're pregnant, but obviously not vascular disease. So tell me how vascular disease affects men and women differently.
It's not, most of the symptoms are because of this is a hereditary problem. It runs in the family. And in the females, being pregnant is a major factor.
Sure.
When their veins give up because of the lot of pressure in there. But any pregnant female who comes to me with varicose veins or any legs feeling heavy, we don't treat at that point. We wait for 6 months.
Oh, okay.
If their symptoms resolve, then it's okay. Otherwise, we treat them.
And for men, it would just be those typical symptoms that you were talking about.
Absolutely. Men, unfortunately, we see them when they have had these varicose veins, big varicose veins on their legs for many years. Then their family is trying to push them, to the doctors.
And so when they come to you, what are the treatments that you do when you work with these patients?
Okay, first we work them out. We do an ultrasound and figure out, which veins need to be treated. We don't treat all the bad veins. The ones, they are really causing symptoms, those are the ones we treat. So the treatment is office-based. It's very simple. We do it under local anesthetic.
Gotcha.
And we do the laser or a chemical ablation. And the patients, after the treatment, they can drive, they can walk, they can exercise. Wow. There are no incisions involved. It's just done with a needle.
So when does it transition then to being a surgical case?
Yeah, these are all surgical procedures, what we do. If the patient has symptoms and the ultrasound shows that they have bad veins, that's the time they should be treated.
So even though they're surgical, this is something that someone could come in, have done right then and there, and they can drive home that same day?
Absolutely.
Wow.
Some patients do go back to work after the procedure.
Wow, that's incredible. Okay,
Yes.
So this is something that if you are experiencing these symptoms, go in and talk with someone like you, Dr. Sharma at Arizona Vein and Laser, and you guys can get this taken care of kind of same day.
Absolutely.
That's incredible.
Absolutely.
So for anybody who may be experiencing this, give us a little bit of information on how they can find you guys at Arizona Vein and Laser.
Do
you have like a website or a phone number?
We have a website,
okay.
Yes, we have a website. They can go on there or they can Google my name.
Perfect.
It comes under my name too.
Awesome. Okay, so just Google Arizona Vein and Laser
That's
or
right.
Dr. Sharma or the two combined, and then they
right.
can find out more
That's
information about this. Okay, well, this is a very serious thing that, like we said, it affects a lot of Americans. So, Doctor, thank you for all the information. And yeah, if this is something that's affecting you, be sure to Google and learn more information about it.
That's right.
All right, thank you so
Thank
much,
you.
Doctor.